Well, welcome back, Desiree, and to your viewers. I am in a cubicle, and I do have with me Wilfred Napier, Cardinal Wilfred Napier. He's going to be vaccinated. I'm just going to speak to Health Minister Dr. Zweli Mkhize. He is a doctor, and he can explain the process. Minister, if you can just tell us what exactly is happening right now.
Well, thank you very much. We're having a vaccination station. So what happens, the person would be assumed to have been registered, or if not at home, but they will register them here before they come in. Then the nurse will then just confirm the details and make sure it's the right person, and then we'll discuss a few things, what the vaccination is all about, what side effects to worry about, any particular diseases to be concerned with, and then are we on your way?
Yeah, you are.
Yes, please, let's open.
Can you move, guys?
We're just going to give some space there.
So once they've explained what the vaccination is all about, then they give you a sense of symptoms to worry about, and give guidance as to what happens if they get the symptoms. Then once that is done, they will then bring the vaccine, and then we'll explain where it's going to be put up. And generally, for everyone is put on the deltoid, on the shoulder muscle. And then with that, then they'll be told, get the injection. Once it's done, look out for immediate symptoms of reaction, like pain, dizziness, headaches, lightheadedness, and so on. All of those will be explained. Then once they are done with the injection, then they are taken to a place where we must sit there for 15 minutes for observation. Again, they need to sit there and indicate whether there are any symptoms. We worry about immediate reactions. Generally, it's allergic reactions and anaphylactic reaction. That's the extreme. And if there's anything that gives you a problem, then they need to be attended to. If there ever is a reaction, there's an emergency resuscitation area where people can be dealt with irrespective of what kind of complication they get. Generally, people just get light pain. Most of them don't get anything but slight pain and lightheadedness and so on. Those things are not very serious, but are also not common. So then after that, that's it. They'll be then told to go. Then because this is Pfizer, then they'll be told to wait for a second response. A second message that will come on to say when they'll come and do a booster dose. So this is where we were very pleased that we've got a cardinal with us here. He's one of those high-profile leaders because there's quite a lot of need for religious leaders to be able to indicate their support and confidence in the vaccine, and also encouraging congregants and all this society to come along and take vaccines.
Minister, before I let you go, can we just touch on also the importance of general practitioners and their involvement in this?
Yeah, we'll discuss all that when we do the press briefing. Yeah.
Okay, thank you, Minister. Let's just listen in, Desiree.
Done? Can you please hold a beat?
Yes, I will. Thank you. Thank you very much.
Cardinal, I must ask, any pain at all?
Nothing at all. Not worth talking about. No, it wasn't even. I didn't even feel like a prick. It was just, yeah. Now what I have to wait for now is to see what effects there'll be afterwards. Yeah. And those have been explained to me. Could be diarrhea, could be whatever, headache, a slight headache or something of that nature. So I'll be ready for anything like that.
Well done,
but from what I hear, most people, there's no side effects at all. Yeah.
From the religious sector, if you could say anything to congregations.
We'll have a platform for that.
Can we move?
Well, Desiree, the minister is saying there will be a media briefing where the media will be allowed to pose all their questions there. We did doorstop them during this vaccination of Wilfred Napier Cardinal, and we are going to be moving on with several other dignitaries joining the minister here this morning, as well as the MEC of Health, Nomagugu Simelane, will be vaccinated. As you can see, they're going into a second cubicle there where we will see another person being vaccinated. I'm going to hand it back to you, Desiree.
Thank you so much there, Jayed-Leigh Paulse. They're doing sterling work, but Cardinal Wilfred Napier there expressing the concerns of many people, the after effects, and that's a conversation we'd like to continue with as we ask you that question: how eager are you to get vaccinated? Let's take a look at some of the tweets that have come.